Hello and howdy, y'all. As we gear up for APIC 2026 in Nashville, we offer an exciting boot scooping episode. I'm Jess Fargher with one of the Cowgirl co-hosts. My preferred pronouns are she, her. And just be prepared for this podcast. I will be using lots of corny, Old West phrases without this episode, just preparing y'all for Nashville.
I love that, Jess. I can't wait to see what's coming. But I'm Kelly Holmes. I'm happy to be here, and my preferred pronouns are also she, her. And we do have an exciting episode for you guys today. We're going to talk about, kind of the intersection between infection prevention, public health reporting, and emerging technology. So using artificial intelligence to support public health reporting. And with us today, we have Jameson Dowling, who's going to walk us through his project. He's presenting this information at APIC26 in Nashville. And we came across this abstract and really wanted to highlight it for our listeners to get you excited about visiting those posters at APIC. There's so much good information there. So today, Jameson is joining us to tell us all about his project.
And before we wrangle today's topic, let's round up some introductions. Meet Jameson, MPH, a data analyst for the Children's Hospital of Philadelphia Infection Prevention and Control Department. He has blazed a trail in clinical research with a focus on pediatric rheumatology, pediatric cardiac arrest, and neonatal sepsis. Always with the long words with these impressive guests on our show. Today, he uses that grit along with his background in public health and epidemiology to rope in complex data for the infection prevention field.
This is good, Jess. It's good. Thank you. So, Jameson, welcome. We've read your bio, but that doesn't tell us a lot about you. So how did you get into infection control?
Yes. Hi. First off, thanks for having me. Glad to be here. So how I got into infection prevention control kind of started with just, I always wanted to be in infectious disease work, but I never really knew the exact line of infectious disease work I wanted to be in. And then during my master's program, I connected with Susan Coffin, who's a doctor here at Children's Hospital Philadelphia and does some infection prevention work with us on a research project on antimicrobial resistance. And that was kind of my first foray into infection prevention work, truly, rather than just an interest of mine. But in working with her, I kind of explored some other things and learned a little bit more about infection prevention. And it kind of, I kind of realized that was where my interests lie in helping to keep people from getting sick. And I'm trained in epidemiology, but I always wanted to kind of be a hospital epidemiologist rather than the community side. And so infection prevention kind of checked a lot of my boxes there. So kudos to Susan Coffin for bringing me in.
I love that. So where'd the data analytics expertise come in? Because I know they don't teach that in epidemiology. I mean, they sort of, but yeah, where'd you get your skills?
I attribute a lot of my skills to the clinical research career I had before coming over here to infection prevention, but also back to my undergrad days. I was actually a biophysics major in undergrad. Which is
biophysics. Yeah.
So just working with a lot of data and doing a lot there, kind of set the foundation for wanting to do work with data, and then realizing where I wanted to apply it in terms of more intersection of biomedical work. So yeah.
Classic Jameson being so humble of his beginnings. Oh, I was just doing really smart things before I went into an even smarter field. That's fine. Huh. That's neat that piqued your interest. I always think that like data is super exciting and epidemiology is super exciting, and infection prevention is the really cool field that can just grab at all of those things.
Yeah, I agree. I mean, I love working with data. I love working in Excel and other programs, RStudio, all that. But I think the best thing is being able to apply those things to something that's impactful and meaningful to yourself.
Well, we are fixin' to see you down in Nashville this year for the APIC conference. And there is going to be a lot to see and hear at the conference. I went last year for my first time. I was a little overwhelmed, so it's nice to get a little bit about you and your poster before going there. Mighty eager to hear some more. Who helped you wrangle the project together and what lit the fire for the idea?
Yeah, so I primarily been working on this project with some analytical engineers here at CHOP, so the coding people, as I like to call them. And I've actually been working with them on the broader project over the last couple of years to just make overall enhancements to our dashboard that we use for this data. During the COVID years, a lot of the public health reporting kind of became a little different, went a little crazy, but then once that settled down a little bit, we were able to kind of get back into things and make improvements rather than just trying to keep up with everything. So we've been making a lot of improvements, and that's where we kind of got the idea to apply some AI to this. I will say, I don't know if my team had, I don't know if we had a fire lit under us to do this. I think we are all a little bit healthily skeptical of applying AI to everything. We recognize that it's really good at some things, still getting better at other things. But we were intrigued, I would say, more than having a fire lit under us, to the possibility that this applying AI could be helpful for this project.
Okay. So you decided to pick respiratory viral symptoms for this project to assist you in public health reporting. So was there like a trigger point that you were like, IPs are spending so much time like combing through the charts and like trying to pick up these fields that we have to fill in on the public health, submissions that we send in? Or like, how did you arrive at this particular project? Was it kind of, based off of a problem that you were having, or did you see it as like, okay, this might be just an interesting place to start to see if it works?
I think you had it exactly at first there. I think our team's approach is we don't want to throw AI, hey, let's throw AI at everything and try and see what sticks. We're kind of taking the approach of find things that there's a true opportunity for improvement through AI, and do the work to develop the proper AI tool for that. And so, yeah, exactly as you said, there was a lot of chart review that was required to get accurate reporting for these respiratory virals. And that's tedious, time consuming. And we realized that if we could get an AI tool to help us with that, it would save us a lot of time and free us up for a lot of other great things.
So the AI tool itself, like you set it up to scan the ED notes. Does that populate then automatically into a report for you, or do you still have to comb through it to kind of package it up and make it pretty before you have to send it over to public health?
So we're still in the partial implementation phase of it. In the sense that we're still doing some prospective evaluation. We've done our retrospective validation, but we still want to make sure it's at a prospective stage working properly. But we do have it pretty automated, where we have the AI tool spit us out the results right next to our manual results, so we can compare them side by side pretty easily. And it automatically does that for us. It's ready when I go in to look at the data. Rather than having to say, hey, I have this data, then go do the AI. We've gotten to the point where we felt comfortable enough to add it into our dashboard. So all the data there is in the dashboard together.
Wow. It's nice to hear that you're saying that you have the manual data next to the AI data, because I think there are a lot of people out there who are already relying on AI to be accurate. And it even says in that little thing at the bottom, AI can get it wrong, just like how a person can get it wrong. So that's nice to know that you guys are doing that as well. I think Kelly already kind of hit that, but when you're doing the ED notes, how did you know exactly which sections to use?
Yeah, so I think we wanted to strike a good balance of giving the AI prompt and the model a very specific thing to do. We didn't want it to go haywire and try and read everything, because then it's going to get confused and add and that's where the errors come in. But we balanced that with where we were lacking on our information. So when a lot of these patients that come in that we're reporting for this purpose, their sickness starts in the community, and then they come into the hospital. So we have good ways to get the data from in the hospital, but we didn't have the best way to get the data from the community, because those are what they report to the clinicians. And so that's where we were lacking. So we were able to focus on the specific HPI of the ED notes, where the doctors are kind of documenting what the patients said they were having before they came into the hospital. So we were able to give the AI tool a very specific, limited, pretty much one big chunky paragraph to read rather than the whole note. So it's very specific and simplified for the AI tool to read.
Oh, that does make sense. Because Jess, I don't know about you, but when I'm reading ED notes, like sometimes in that HPI section, it'll say, something very descriptive. But then if you go down to like the assessment of the organ systems and like, they might say something about the lungs up in the narrative part, but then in that lungs part that's down below, they say everything's normal, everything's okay. Yes. So I was really curious if your AI like got confused by that, because it confuses a human, so that's really interesting. Did you find any issues with that? And maybe not, since you only use the HPI piece.
Sometimes even in that HPI, there's documentation. There's contradictory documentation. Yes. So there's some issues. We going into the project, we knew that even the doctors don't capture everything properly, and they don't capture everything comprehensively because the patient might have forgotten about a symptom or whatnot. So we do recognize that there's still going to be some misses, but in general, we have been very impressed at the AI tool handling those any slight confusingly worded statements or any contradictions. It does a pretty good job. And with the contradictory stuff, we kind of always revert to the negative rather than the positive. We would rather miss a symptom than incorrectly capture a symptom.
Okay. So I'm imagining your AI tool as an old prospector who's just shaking all of the like notes and then panning for that gold and be like, there it is. I got it. Winner. Anyways, that's how my brain just comprehended how your AI goes through the ED notes. But Kelly, when you said that, I feel like every infection preventionist listening out there is screaming, yes, I know exactly what you mean, where there's that contradictory information where they're like, okay, but why didn't you put that note down here exactly where that heading is?
Right. And what do we include? What's the actual truth? So yeah, with your AI tool, I also love how you said you set it up, beside your manual abstraction so that you can compare. So really, I think when we think about AI, we're like, oh my gosh, it's going to take over. It's going to all be automated. But what we're like entering is like a decision support phase. We're entering like the co-pilot phase of AI, where it's like decision support, and it's helping us like be better at our job, so that we can more quickly decide, what's relevant and what's not relevant. So I think that's incredibly valuable. But for us who are not, super AI savvy, could you tell us about, how you validated that model for accuracy? Like, what does that actually look like? And then I know that you have an AI governance committee. So, what was that approval process like? And just kind of walk us through, especially for people who are not, that far along with it.
And in case anybody wants to copy exactly what you're doing, let's give all those details.
Yeah. So I think I'll comment on the oversight committee first at our institution. I think that's really important, especially. I know every industry has security and safety concerns, but I think it's particularly important in healthcare, obviously. So having oversight on your AI is really important. And so early on in the process, not before we came up with the idea, but we came up with the idea and kind of started to develop it, work it, tease it out a little bit, and then we had to write up a proposal and submit that to our governance committee to get kind of approval to move forward. And then they say, hey, okay, reach back out to us in a month, 2 months, 3 months when you're done more of the work, and you can present to our committee. And that's the presentation where we'll then go back and discuss with our team and with the committee and officially give you approval at some point or not. So kind of seeing what tools are useful and safe for the enterprise and aren't going to be a waste of energy, a waste of anything, waste of resources, all that kind of stuff. And then to the validation side and kind of the development side, we did a lot of what we were calling PDSA cycles, but just a lot of iterations of giving the tool data to learn and then having it give us some results, checking those results, and educating it more. So the first one was we just had a big, huge data set of manually collected data from these ED notes that I personally read through all of them myself, and we gave that to the AI and said, okay, use these to kind of develop your rules, and then we refined those rules a little bit at some certain points that the AI might have missed a little bit, and then we kind of just gave it a few samples of ED notes to read, and we got the results and say, okay, you missed this, do this instead. And it also helped us realize where we could get better at telling the AI tool what to read. So we did that several times. And then
more than 100.
Less than 100, but
okay.
I did a lot myself, and then my teammates did a lot themselves as well. And then once we got to a point where we felt it was performing pretty well, we did just a pure structure validation where we got a set of results from the AI and then of ED notes that I had not read before, and then I read through them myself, scored them, and then compared their results. And we had some thresholds for the amount of positive misses and then false positive as well. And then we learned some things from that, did another training of the AI, and then did another validation, learned a few things from that. And now we're in the partial implementation stage I was talking about earlier.
So basically, you were the sheriff of the old Wild West, training the deputy on how to do the job. Yep, I'm going to keep adding these Nashville Wild
Bring us
West.
back. Bring us back to Nashville.
Oh, wow. That is a lot. And I need to know if, one, you were a reader already, and if going through all of those notes ruined reading after work.
I am a reader. I might not have realized that in the moment, but it probably did make me save some of my reading for the weekend rather than the weekdays. But I am a slow reader, so maybe that's why I'm so excited about this AI tool as well.
And I think, it's probably worth mentioning for everybody listening, you're not using ChatGPT, you're not using Claude. These are enterprise level tools that are behind a firewall, right? So we know that Chat and Claude and all that stuff's not HIPAA compliant. So that would be a huge, horrible thing. So what is the tool that you guys use? Is it like a co-pilot or what is your enterprise level tool that you're using to do this?
Yeah, so actually I do, I don't know we changed tools at one point. So okay. I don't know which one we're on currently. But it is just a contracted out one that we use other companies' tool, but we have our own version of it within our firewall and is HIPAA compliant, and all our information stays only within CHOP. It doesn't go back to the company.
Okay. Yep.
That's a good point, Kelly.
Yep.
I'm hoping whomever is listening to this episode doesn't jump on ChatGPT and put in all that information. Right. So please, if you're listening, don't do that.
Yes, exactly. I don't want to be the one in the headlines that was like, oh, guess who released all these medical records to chat. Yeah, that would be terrible. Terrible,
It's
terrible.
got your face on a wanted poster.
Yeah, exactly. Like, bye-bye.
So you've rounded up all this data. Okay, we're in the Wild West. You're hitching these results up to a wagon. And how are you driving them into everyday clinical practice? Is that already a thing? Do you have a timeline? Tell me, what are you doing about this?
Yeah, so with the partial implementation, we're using this data. I'm still doing the manual check, but we're using this data to help support our reporting, and getting it just is going to help us get the information to our DOH partners a lot quicker, so they can kind of have a better pulse on community prevalence of these things and what's causing patients to come to the hospital and from the community and whatnot.
Well, hot diggity dog.
Yeah. How much time do you think it's going to save you, ultimately, Jameson? I mean, I'm assuming that you still are going to do spot checks, probably, always, as part of the validation process. But do you have any idea about, time saved?
Yeah. One other quick point on more prospective validation. So we are going to do periodic spot checks, but we also downloaded a separate manual data set that I put the results again, and every month we're going to run that downloaded data set through the AI tool and see if it's getting the same results consistently. Because sometimes AI starts to teach itself things, which we don't want to happen. It starts to hallucinate. So this kind of gives us like, hey, this is our foundation. As long as it's staying true to that, that's a good first step. But then we're also going to do periodic spot checks of the data it spits out as well. It's going to save a lot of time, especially in the heat of viral season. Right now it's settled down a little bit, but sometimes it takes up an afternoon, a day of my whole week. So, and then I just get behind on everything else.
Yes.
So, we report around 500 of these cases to just the Philadelphia DOH every viral season, so over like a 3-month period. But we also are working with other local DOHs around us as well. So there's a lot of reporting being done, so it's going to save a lot of time.
I love that. More time to be out on the units, more time to be educating staff, more time to be rounding and effective, in where we need to be. So I love that. So, okay, what surprised you as you were, so you had kind of this idea for this project and you're like, okay, it's going to work like this. And, now you've been in the project for a little while. Like, what do you think surprised you the most along the way? Or what, did you learn that you weren't expecting?
One thing that I really liked, and I think we all know the power of teamwork, but I think this really highlighted it. Having a collaborative group of people, different mindsets, different eyes on this really helped remove bias in terms of what we are training the AI on. That was really a big highlight from this work. And then also just the other thing is how much work it does take in terms of all that validation, all those cycles of training. I was talking to a buddy actually just recently who had no idea I was doing this work, but he said, you have to treat AI like a human child. If you tell it to do something...
Oh, don't say this. This is part of my presentation. No, go for it. Go for it, Jameson.
If you tell a kid to do something, they'll figure it out. They're really, really smart. But they'll figure out a way to do it, but it might not be fully right. Yep. But if you give them a little bit of guidance and a little bit of support and a little bit of education, they're gonna figure it out much better. Absolutely.
It's a toddler.
Yeah.
Do you have children?
No, I don't. But pediatric hospital and working.
Oh, yes, yeah. And I think Kelly can agree with this. It's absolutely a toddler, and it's like, hey, I did this for you, and you're like, that's great. I'm so glad you got water. I wanted it in a glass, not on the floor. But you know what? Good try. Let's work on this again.
I would argue that the same goes for teenagers too. Maybe AI is a rogue teenager sometimes.
Oh my gosh. Okay. Did you have anything else that possibly surprised you, or maybe has this led to another project that you guys are considering?
I think the one other thing that surprised me was actually how accurate it was. And I think one thing we always kind of throughout the whole process we were comparing it to was the old school like chart word search and phrase search that people have been trying to use in medical record review forever. That just never works
Mm-mm,
because
mm-mm.
it misses all the context and all the nuance and all the yes and no's and oh the sibling had this
Yes.
but not the patient that gets documented in the notes. So it was really impressive how well AI was able to understand the context of the notes and the nuances and anything else that didn't apply to the exact patient. Um, and kind of with that, when we presented to the governance committee, there's a lot of other people who are not officially on the committee that come to those presentations at our enterprise. Other people who are presenting their AI work, other people are just interested in AI work. Um, and a lot of them, like their brains were firing left and right. They're like, oh my God, I can apply this to this note, to this note, to this note, to this note. So our analytics engineers developed a little bit of a like baseline framework on what we did, so that a baseline prompt that can be edited to other note types. So I'm not doing any other projects with this right now, but throughout the hospital, our baseline prompt is being adapted in several ways.
Mm. I really enjoy that you made a poster about this and came onto this podcast because I think that's the great thing about infection prevention or anything public health or hospital related. We love sharing that information. We want to improve health for others. It's not like we want to covet it and be like, we're not the bad guys here.
Yeah.
So I love that you guys did that. Kelly, anything before we go into our lightning round?
No, let's do it.
Yes. Okay, Jameson, I'm putting you in the spot, not like you haven't been there this entire time, but I need to know, Wild West or are you a city slicker? Go.
City Slicker.
Really? I mean, I
I
guess
mean,
you are in Philadelphia. So.
I like the true Wild West of like being in the mountains and being hiking and
Hmm.
whatnot, but Northeaster through and through.
Okay, all right. I can accept that you had an answer on the spot. I appreciate it. We've already gone over that you are a reader, but you are a slow reader. I'm in the same boat. So I am curious, would you rather listen to a podcast or an audiobook?
Podcast for anything that's not already in a book. Book for things that are already in a book.
Okay. Anything you're listening to right now? Besides listening to this podcast that will come out in June, right before the APIC conference?
No podcast right now. I often pick up movie podcasts to listen to
Oh,
here and there.
That's a good
yeah.
idea.
Interesting. Any audiobooks?
Nope, but I am reading Bonchan by Nasumi Sozoke. It's
Sure.
old. It's old book, but there's one book I'm waiting to come out soon that so I just picked up this other one I saw on a bookshelf.
Can you tell us what book is coming out, or is it like a little not embarrassing, but you're like, I don't want people to know I read blah blah blah.
No, it's called The Book of Records by Madeline Teen. I might be butchering her last name, but I like reading paperback rather than hardback, and it's
Hmm.
been out for about a year, and the paperback's finally coming out now. So I've been very patiently waiting for a year to get the paperback. So I'm really looking forward to it.
They are lighter. They're lighter. They're easier to hold. They don't take quite as much space on your bookshelf. Yeah, I
If
get
I'm laying
that.
on a couch, I don't want to. If it falls on my
Yeah,
face, it won't hurt as
heavy.
bad.
Oh,
Agree. Agree.
perfect to bring to the beach.
Yep.
Put in your saddle bag when you're riding your horse, everything like that.
And can I just say, Jess, I just noticed that you're wearing your Western. You like dressed for the success today. I am hugely
If you're
impressed.
not watching, you should log in somewhere, YouTube, APIC. I am wearing my Western shirt. I found it, if anyone knows of Pendleton, Oregon. Anyone?
Mm-mm, mm-mm.
Okay. Beautiful town, and they had a vintage shop, or maybe still do. Went in there and I was like, oh, I need this. I need this shirt. I am in Pendleton, Oregon, and I need to look the part. So please hop on if you are listening and you want to know this beautiful Western shirt.
Oh, I love it. Next time, text me so I can match. Yeah, I didn't get the memo. Okay, Jameson. So APIC conference, newbie or veteran?
Newbie.
First time?
Yep.
Okay, so what are you looking forward to the most?
I think my favorite thing about conferences is going to presentations that don't necessarily align directly with my own personal work, my own personal day-to-day, and finding little tidbits from those that I can apply to my work. Even if the broader concept isn't fully applicable, I think there's at least one little thing you can take from someone else's work that you can use in your own.
I love that. It's really
That
good
was a good
advice.
answer,
Yeah.
but not great. The better answer would have been meeting me and Kelly in person for the first time. But I will let it slide. I'll let it slide.
That's number 2.
Thank you.
But, that's such a good point. Like, that is how we grow, right? We've got to, if we stay inside of our box and only go and listen to all the things that are, inside of our comfort zone, like, you're not going to grow professionally or personally. So, yeah, like, go to the APIC conference, look at the amazing lineup that they have, and like, go challenge yourself. Go listen to something that you don't know anything about. Go review those posters that, sound interesting to you. And it's a really great way to just expand your horizons. And I know that when I get home, I'm like literally exhausted. Like I'm like exhilarated, like all this like, but then I'm so tired. Like my brain is just like overload, can't form sentence. So it's such a great experience.
Absolutely. I felt like that for my first time last year. And in the middle of one of the presentations, I had to get my notebook out at that time because I was going to lose the thought and be like, oh, I need to do, and then I will text my boss. And I think this project would be great. And then I go, pay attention. There's probably a lot more good information. And going back to what you said earlier, Jameson, having all of those different perspectives on your team coming from different avenues and treating that AI. So I think of that as the conference as well. And Kelly, you were saying, go to those presentations you are unaware of. It really does give you that inspiration and motivation, I think.
Agree. Being with like-minded professionals in the same space, it's really validating and invigorating. So go ahead.
Jameson, do you have any questions for us? Anything that has been mind-boggling? Maybe you don't know about the conference, or you're just like, who are Jess and Kelly? Before we wrap this up.
Do you guys have any presentations at APIC?
I do.
Yay! I'm so excited.
It is on Tuesday. Don't ask me the time, but it's called From Boring to Brilliant. Infection prevention, presentations, and education utilizing AI. Basically, how to teach others to make a presentation fun using AI as a tool, not to make it. So when you were saying your little kid toddler thing, and I was like, oh no. But it's nice to know that a lot of people think of that. So this will be my first, and I'm very nervous. So any tips, Jameson, since you present all the time?
Luckily, I haven't presented too much recently, but a lot in the past. My tip is, honestly, my trick is I just kind of forget that there's people out there, and I just talk.
You just talk? Who are you talking to?
I mean, I got an inner monologue all the time. Now it's a vocal inner monologue.
That's great. And
Probably not the best tip, but
no, that is good, because sometimes when you look out, even during like I don't know if you see this, but if anyone's watching, I get red in my face. It just happens naturally, just when I'm talking to people. And when it's a larger group of people, I will become like a tomato, but I can't let that, get into my head. So I just keep talking. It usually settles down. But I do want to know, for anyone who is interested after listening to this podcast, if they have questions about your project and they're not able to make it to the APIC conference, is there a way that they could reach out to you, maybe a social media or LinkedIn?
Probably just reach out to the CHOP infection prevention team, or my email, or through APIC. APIC contacts will be able to get you into contact with the Delaware County area, Delaware Valley area APIC regional group, who will then be able to connect us.
Okay.
Well, I think that wraps up our episode today. So Jameson, thank you. Huge thank you for joining us and telling us all about your project. Cannot wait to see your poster. So definitely going to stop by. And I hope all of our listeners stop by as well. Explore those posters. Don't forget, Jess is also presenting on Tuesday. So let's go cheer her on. And I'm just really excited for the conference coming up. And, thank you, Jameson, for, giving us an illustrated example of how AI is being used practically to offer decision support to infection preventionists and make us more effective at what we do. So thank you so much.
Yeah, thank you so much for having me.
Thank you.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.